Why doctors strongly discourage formula feeding in the first 10 days of a baby's life. When a baby is born, their body begins the incredible journey of adapting to life outside the womb. In those first few hours and days, every moment is precious, and every drop of nourishment shapes the foundation for their health. Doctors across the world emphasize that during the first 10 days after birth, nothing can replace the value of mother's breast milk, especially the thick, golden liquid called colostrum. Colostrum is often called the baby's first vaccine, nature's perfect food, and for good reason. It contains powerful antibodies, immune-boosting cells, and a concentrated mix of proteins, vitamins, and minerals. It not only feeds the newborn but also acts like a shield, protecting their fragile body from infections that their immature immune system cannot yet fight off. The first 10 days are often called the golden window of breastfeeding. During this time, the mother's body is learning how much milk the baby needs, and the baby is learning how to latch, suck, and swallow efficiently. When formula milk is introduced too early, without a medical reason, it can disrupt this delicate natural process. The baby may become less interested in breastfeeding, leading to weaker sucking reflexes, while the mother's breasts may receive fewer signals to produce milk. This can reduce the long-term milk supply, making it harder for the mother to continue exclusive breastfeeding later on. Another important reason doctors advise against early formula feeding is the digestive development of the newborn. In the womb, babies are nourished through the placenta and do not use their stomach and intestines to process food. After birth, their digestive system is immature and extremely sensitive. Breast milk is perfectly designed for this stage. It is easier to digest, prevents constipation, and contains enzymes that help the baby's gut mature safely. Formula milk, on the other hand, is heavier and more difficult for the newborn's tiny stomach to handle, which can lead to discomfort, gas, bloating, or feeding intolerance. There is also a deeper, emotional side to this recommendation. Those early days are not just about feeding, they are about bonding. Skin-to-skin contact during breastfeeding regulates the baby's body temperature, heart rate, and breathing. It also triggers the release of oxytocin, the love hormone, in the mother, strengthening the emotional connection and even helping the uterus recover after childbirth. Formula feeding in the early days may unintentionally reduce these intimate bonding opportunities. Doctors only recommend early formula feeding in specific cases, for example, if the mother has a medical condition that prevents breastfeeding, if the baby has certain metabolic disorders, or if there is a significant delay in milk coming in and the baby is at risk of dehydration or low blood sugar. Even in such cases, doctors often suggest using expressed breast milk, donor milk, or supplementing in a way that still supports the mother's milk production. The World Health Organization and UNICEF both stress that exclusive breastfeeding for the first 6 months is the gold standard for infant nutrition. But the journey to those 6 months starts in the very first week of life. By avoiding formula in the first 10 days, unless truly necessary, parents give their baby the strongest, healthiest start possible. It's also worth noting that colostrum is not just about physical health, it plays a key role in building the baby's gut microbiome. This is the collection of healthy bacteria that will support the child's digestion and immunity for years to come. Formula milk does not have the same live components and immune factors, meaning babies may miss out on this early microbiome foundation if formula replaces breast milk too soon. For new mothers, it's completely normal to worry whether your baby is getting enough in those first days, especially when colostrum seems so little in quantity.